Welcome everyone. Thank you for joining our Nursing Product and Solutions Showcase, your inside look into the innovative solutions that are impacting healthcare education, providing higher quality learning for next generation nurses. With us in studio today is Product Manager Lucas Tomczak, who will be walking us through these solutions and answering your questions at the end of our webinar. We'll also hear from our Global Education Specialist, Paul Foxlater, from our studio in Norway, who will provide us with an inside look at our most innovative hybrid solution for nursing, known as Sim Capture for Skills with Modular Skills Trainer. Lucas, thank you for joining us today.
Thank you, Charlie. Hello, everybody, and I'm happy to be here today with all those attending today's session, as we have some great new solutions to talk to you about today. Before we take you on a journey of showing you the complete learning simulation solution, we understand that you all have different needs. Some people are thinking about solutions that bring the simulated experience further into the lab with your students, while others are really looking for learning solutions that can seamlessly shift from inside the lab and take it to practically any learning environment that we can think of. Even 2 years later, we're still feeling the impact of the pandemic, where any solutions should be able to easily pivot between one or the other to produce uninterrupted learning for students. During these past couple of years, we've had an opportunity to speak with many of our valued customers, hear about their present and future challenges, and find ways to translate these needs into features or ways to use our simulations more efficiently in the simplest possible way. With the increasing shortage of nurses, preparing students for practice with the competence to handle the unforeseen realities of healthcare and caring for diverse patients is at the forefront of voiced needs. Helping schools with solutions that will increase pass rates with more confident clinicians as they build their skills and become practice ready. While this shortage impacts healthcare around the world, the challenge faced by schools is that while preparing students to pass competency-based exams such as the NCLEX here in the US, they must do so with either limited amounts of staff or budgets that may have been impacted by the pandemic. Saving time and cost with options that do not require lots of different sets of hardware and the need to demonstrate a return on investment requires making the most out of educational tools and solutions to work seamlessly together and to improve student learning with the essential skills they need. To demonstrate return on investment and make the most out of students' learning experiences, there must be an increase of efficiency in providing quality training and education with more practice opportunities, giving students a way to continually practice without relying as heavily on campus resources or having instructors present. Learning platforms that encourage independent repetitive practice from a student's own device provide them the ability to improve clinical judgment and make decisions that would be expected of them in real practice. This is where high-fidelity virtual simulation, as part of a well-rounded educational solution, has been proven to make a difference, not only during, but also beyond the pandemic, and has become a trusted form of training today. Meet Nursing End Simulator Modular Platform. She was first introduced in 2018, and she's gone from a realistic patient simulator to become a full modular platform, delivering basic to specialized skills practice, and is also compatible with other technologies to really enhance the simulation experience further. We have several patient modules today that we'd like to show you, including a sneak peek at our latest addition to this modular platform that's going to be launching very soon. We're going to start with our female patient simulator that you're all very familiar with, as that was the first module that was launched globally several years ago. What I have today is a dark version of Nursing End Simulator. And as you can see, she's a female patient from top to bottom. She is made with silicon-based skin to allow to really extend the durability, to reduce the amount of cleaning and maintenance that is required, and really to give more of a realistic, natural feel when you touch her. One of the things I like to highlight on Nursing End Simulator, first up, is her ability to sit up without assistance. So if I just sit her up like this, she will sit on the bed without any additional support. This is a really great opportunity to highlight her breath sounds as well. So we have gone for anterior and posterior breath sounds, and I'll just take her gown down. You okay there, Nursing End Simulator? Just exposing you a little bit, I'm sorry. She does have breath sounds on the back, both upper and lower lobes, left and right, as well as breath sounds on the front, upper and lower lobes on there as well. We also have breath sounds on the sides for the axilla. Now, as she's sitting up, I'd like to highlight some of the anatomy that we have on here. So we do have a spinal process. We do have ribs to allow you to actually count the locations for your auscultation. When we look at the front, just popping you back down there a little bit, love. Cover you up a little bit, we're still going to be talking about you. As you see on the front here, we do have even veins to really give you that realistic anatomical look. We have a sternum here as well. We have xiphoid process. We have actual ribs around that you can actually count and find the location marks for your where to listen. We do have heart sounds as well on here. And if I start thinking about her from top to bottom, really, we've got blinking eyes to allow you to give you that conscious state, conscious response. You can control the blinking speed, you can control the blinking movement as well. And as we come down, we have an anatomically correct airway to allow for the placement of oral and nasal airways, for the placement of laryngeal mask airways or other adjuncts of those kinds. It allows you to place an ET tube as well down into the trachea. And if placed too far, it will cause a right mainstem intubation on her as well. It does allow as well, nursing in simulator, for the placement of a nasogastric tube, including the measurement from the ear, nose to the xiphoid process. Speaking of the ears, we do have ears to allow for the placement of nasal prongs and even Hudson masks, so you can actually place them and tighten them as you normally would. We have a tracheostomy site, allowing you to practice the care and maintenance of a trach tube on a patient. And as we start coming down, just uncovering you a little bit more here, love, we have a site here for a central line to allow you to do dressing changes and actual care and maintenance of a central line, including injection training. We have a couple of sites for stoma care and allowing you to do the colostomy care and changing of the pouches. We have a G-tube site as well, allowing you to feed through the G-tube. One thing as well allowed on the belly is subcutaneous injections when you have the subcutaneous module. It simply slides underneath and then you can perform subcutaneous injections just right there in the abdomen. Everything we tried to do with Nursing and Simulator, we tried to make bilateral on both sides. So you will find nothing is replicated on one and not on the other. To give you some examples, we have a pre-ported IV site on one side and we have one on the other side as well, allowing you to give medications and give fluids. We have pulses, both radial and brachial on both sides, and we also have the ability to do a blood pressure reading on either side, both manually and automatic, with a site to actually get Korotkoff sounds out of as well. You will have noticed a lot of articulation going on here. So we've got the arms, we saw her sitting up. I'm just going to cover you up a little bit here, love, just to maintain your dignity. But in addition to that, we also have complete articulation of the legs and hip as well. This allows you to perform a Foley catheterization completely from start to finish as you would on a real patient. The articulation that you find on this patient as well allows you to practice patient movement, patient handling, as well as allow for placement into various different positions, including cars, beds, seats, wheelchairs, as we will see shortly as well. As we're coming down the legs as well, we also, in addition, have pedal pulses on either one of these sides, both left and right side. So I mentioned everything is bilateral on the mannequin, everything is on both sides. It will allow you to do high volume fluid scenarios. There are bypass valves and tubes inside to allow you to really take on high fluid loads when you are treating this patient. And we also have a range of accessories and modules already available for our Nursing and Simulator standard. Some of those include a mastectomy front skin that simulates a post-mastectomy patient for the care and assessment of a mastectomy. We have, I mentioned, the subcutaneous pads for subcutaneous injections. We have staged wound feet to allow you to train the 4 different stages of pressure sores as well as diabetic feet. In addition to that as well, we have a sacral wound, a level 4 sacral wound for the backside of the mannequin to really give you that realistic hospital in-bed care. That, I think, covers most of the features for Nursing and Simulator, and I'd love to give you some examples of some of our extensions, such as the geriatric Nursing and Simulator. Now, I'd like to introduce you to Nursing and Simulator Geriatric. We released this to really help and support geriatric patient care, including communication with the patient and just diversity for patients in general, for students that they're challenged with in their training. So we developed the Nursing and Simulator Geriatric, available in both full body assembled mannequin as well as an upgrade kit to be able to change your existing Nursing and Simulator into the geriatric model. And we really tried to focus on some of the key geriatric elements when you're looking at nursing training. So firstly, from an appearance point of view, you can see it's quite realistic from a presentation, even age spots, etc. So we aim for realism there. We do have pupils that are age appropriate. Currently we have cataracts in there, but there is a range of them that come with it, including arcuus senilis and cataracts and others as well. We have teeth that are appropriately aged and also dentures down there. As we come down, we have anatomical sites that you would expect from a geriatric patient, and as you can see, it could be both a male or a female pass 4, depending on what type of a presentation you would like for it. As we come down, we do have realistic anatomy here. We do have arms that are appropriate as well, age appropriate, with both age spots and the correct presentation. In addition as well, we have changed the pre-port on our nursing and geriatric to be this newer design that allows for a placement of a needle and then the removal of a needle and leaving of the cannula in there to allow you to provide fluid straight directly into the patient. As we come down a little bit further, just going to expose you a little bit more here, love. I'll help you out by covering you up down here. We do have both male and female genitalia to really support the gender agnostic presentation of our geriatric. We currently have the female genitalia here, allowing you to actually perform the catheterization, and as before, articulating legs, as we had with the nursing and simulator. As I come down a little bit further, we've also provided some age-appropriate feet for the geriatric patient, and as I mentioned before, the staged wounds are a beautiful addition to these as well. So this is our bit of a summary for the nursing and simulator geriatric. Now, diversity, equity, inclusion have been guiding stars in Laerdal for a long time now. And in addition to the nursing and simulator in dark that you saw me demonstrate earlier, we also have released the African descent front skin and wig as well kit for the nursing and simulator. Now that was a couple of years ago, and we have heard from the market that you would like this combined into a single mannequin. So we're excited to announce that we're also going to be releasing the nursing and simulator African descent full body assembled mannequin as well to complement our range of full body mannequins. Now I know we promised you a sneak peek, and what I'd like to show you now is nursing and simulator male. This is our male version of the nursing and simulator platform, and it will be available with a front skin, new male arms and male genitalia. These will be available in both an upgrade kit as well as a full body mannequin to allow you to really continue on the journey of diversity, equity, inclusion. The skins are very simple to take on and off the mannequin. It's a matter of unzipping on the top, unzipping the sides, and taking them off and swapping them over. Now, as I mentioned before, you can take a simulation training further by combining the modular platform with additional solutions. The ASL 5000 for advanced respiratory management training, and SimCapture performance and debriefing management system. Having a high fidelity modular platform that allows you to quickly change your students' training to address diverse types of patients is itself an efficient solution to having purchased multiple mannequins to achieve the same versatility in your training. But where do you start when you have this modular capability and you need that same level of diversity in your patient case scenarios without having to create a case for each patient? We now transition to the next segment in our presentation, integrating your modular platform with a robust online library of expert-authored patient cases. Meet Laerdal's Scenario Cloud. While Laerdal Scenario Cloud was originally introduced a while ago, many are not aware of the power this learning library can provide when pairing patient cases with your high-fidelity simulator. Imagine having over 500 validated scenarios from industry experts right at your fingertips, ranging from basic skills to specialized practice. It even includes 20 complimentary free scenarios that are available to you to help you optimize the use of your simulators, such as nursing and simulator. Laerdal's Scenario Cloud is the perfect companion for your SimLab, facilitating training so that your faculty can spend more time with students in the lab without the time-consuming task of having to create training scenarios, as that part's already done for them. So, as an example, you have a nursing and simulator patient in your simulation lab. Faculty may want to look at the training scenarios available for a nursing and simulator. All the scenarios are fully equipped with setup tips, equipment checklists, learning objectives, assessment and debriefing points, guiding questions and evidence-based references, just about everything they would need to implement the simulation. As they create their program, faculty can group all of their patient case scenarios as part of one collection, or they may group cases based on curriculum goals or other themes. With seamless integration from your SimPad or Leap PC, you can easily choose a scenario that meets your curricular needs and quickly be on your way to running high-quality, hands-on simulation training sessions.
Thank you, Lucas. In our last segment for today, Paul Foxlater will focus on skills proficiency and how you can eliminate time constraints for deliberate practice and resource shortages that many nursing schools are facing today.
Thank you. My name is Paul Foxlater and I'm the Global Education Specialist for SimCapture. Today I have Mariam with me, and today we're going to demonstrate an intramuscular vaccine using the Modular Skills Trainer and SimCapture for Skills. At Laerdal, our mission of helping save lives extends beyond resuscitation. It extends into nursing education providers. Our customers often report to us that they just simply don't have time to spend with students for assessment, evaluation and facilitation, and of course debrief. We often see this in psychomotor skills. Our customers often report that we simply don't have time for students to practice psychomotor skills. SimCapture for Skills with the Modular Skills Trainer provides more opportunity for students to practice informative skills practice. Today we're going to use SimCapture for Skills with the Modular Skills Trainer in a peer-to-peer methodology. You can choose to use any task trainer that you have. The Modular Skills Trainer has 16 skills, such as intramuscular injection, IV insertion, stoma care, and central line insertion. Mariam has already logged in to the web application, and what you can see on the screen here is how many sessions she's completed, how many skills she's learned, and her average score. It's important to note that SimCapture for Skills can be used on any device as it utilises a web app. On her screen here, she can see the course that she's been added to by her faculty, and she can see a curriculum of scenarios. Today, she's going to choose peer-to-peer intramuscular injection to do a vaccine. The next thing that Mariam sees on the screen here is an overview and some learning objectives. This helps set expectations during the scenario. It's also important to note that all of this information comes from your curriculum, so it's aligned with your learning objectives. She will then choose practice.
Select practice.
And now she's going to choose practice with her peer. Mariam is assuming the role of the peer learner, and she's going to choose me as the peer facilitator. It's important to note too that peer-to-peer is not a new methodology. We often see students who will watch a demonstration by a member of faculty and then break away into small groups in order to practice that psychomotor skill. The web app is now telling her to pass it over to the peer facilitator, which is me. The first evaluation that we have here is called the pre-reflection. In this particular scenario, we've got some information and an equipment checklist, and also a few questions to set us up for success. The first question is, which site would you typically give a vaccine?
I would choose the deltoid.
And how do you locate the deltoid?
I would locate the acromion process, and I would have 2 fingers just below that, and the injection site would just be just below that.
We also have the rights of medication. Once I have finished with the pre-reflection, I would then choose Begin Checklist, and we move into what's called the live evaluation. So we can see here there's different evaluation questions on the screen. The first one is Introduce Self, including name and role. Mariam will actually talk to the modular skills trainer, and I will answer as the patient.
I'm just going to start by washing my hands. Hi, my name is Miriam, and I'm going to be your nurse today. Can you tell me your name?
My name is Paul.
Nice to meet you, Paul. I see that your physician has prescribed a vaccination for you today. Is that correct?
That's correct.
Perfect. Have you had this vaccination before?
Yes, I have.
Okay. Did you have any problems or reactions after that vaccination?
No, I didn't.
Okay. Do you have any known allergies to medication or food or drugs?
No known allergies.
Okay. Usually after the vaccination, we ask you to stay about 15 to 20 minutes, making sure you respond okay to it. And I've come prepared. I've got the vaccination with me. And I will have checked your ID band and the prescription order and the medication administration record to make sure I've gotten two identifiable characteristics. Paul, do you have any questions about the vaccination today, or am I okay to go ahead and give it to you?
No, you can go ahead, please.
Okay, perfect. And do you have a preference of left or right side?
In my left arm, please.
Okay, perfect. I just want you to relax your arm, make it like jelly. Perfect. Okay, I'm just gonna again locate the injection site. Perfect. I'm just gonna cleanse the area. Waiting for 30 seconds to dry. Okay, bit of a poke. And then I'm gonna slowly inject the medication. Perfect. Apply pressure and just get rid of my sharps. Okay, Paul will just ask you again to wait for 15 to 20 minutes, and then I'm gonna tape this down. I'm gonna get rid of my equipment, and then I'm going to wash my hands and document the procedure.
So now that we've finished the live checklist, we've moved into the post-reflection, and these are the questions that we have at the end. So she's performed her hand hygiene, she's discussed post-injection care, she's documented, and she's ensured that I'm educated for any adverse reactions. Once we have finished this evaluation, I will then hit submit. And we will now be able to debrief one another from the scenario. So I can see the things that got correct, and I will also be able to see anything that Mariam got wrong. We can see an overall score, which helps with gamification of the scenario to motivate us to learn. We can also see a score against the question categories. It's important to note that each evaluation question is aligned to a category. Again, these will be objectives from within your curriculum. We can then choose to practice again or go home. SimCapture for Skills peer-to-peer scenarios are ideal for formative assessment of psychomotor skills. We can also use the self-record scenarios. This is where the student will record themselves doing a skill and then submit it to faculty for marking. This is ideal for individual skills practice or summative assessment. As students use the scenarios, all of this information is collated into easy-to-read reports. You can see on my screen here, I'm looking at the results tile. And so for my whole course, I can see that the top performing question category, which is 80%, is nasogastric post-insertion care, but the bottom performing category is skill-specific pre-knowledge. This will alert faculty of course areas of improvement. These graphs on the screen here represent individual evaluations that have been run. I can see here for the peer-to-peer activity with a partner that the maximum score is 100, the minimum is a 0, and I can also see the quartiles and the median. The next report I'm going to look at is the question analysis. The question analysis analyses the questions that were asked in the evaluation. The coloured area to the centre here will draw my eye to areas of improvement. I can see here that confirms the patient's name and date. Gains consent are areas that aren't occurring as often as other areas. I can also see within here, I can see the number of credits, the number of full credits, and also the mean score. The question analysis report is ideal for learning needs analysis at the cohort level. There are also many other reports that are available for individual learning needs analysis and cohort analysis, and we can also download these reports as an Excel. Thanks, Miriam. That covers Sim Capture for Skills with the Modular Skills Trainer. Thank you.
Thank you again, Paul and Lucas, for showing us how to use different types of simulation training solutions to make the most of training opportunities with many diverse patients. We've received some questions while the webinar has been ongoing, and I'd like to ask you a few of these questions, if I may.
Sure thing. Sounds great, Charlie.
So the first question we've received is, are there any features or functionality differences between the different modules of Nursing and Simulator?
Look, that's a great question. Of course, other than the obvious difference that you would probably see from a female nursing and simulator and a male nursing and simulator, which would be the Foley catheterization, there are also the more subtle ones that you would find with, for example, the geriatric mannequin that you have beside you, with different eyes, teeth differences, and just the anatomy in general being more appropriate for geriatric presentation. So there are some functional differences, yes.
Great. Thank you, Lucas. Next question we have here, do all skins come included with the mannequin, or do you need to purchase the skins separately?
Good question. So they don't come all included with the mannequin. You do need to purchase the additional skins that you do require for the mannequin. However, if you are purchasing, let's say, the Nursing and Simulator Geriatric, you would get all the geriatric skins that would be included in that. The African descent, for example, would be all the dark mannequin and African descent skins will be included in that as well. But what you wouldn't get is, for example, the male or the geriatric included in that as well. So it really depends on which mannequin you're purchasing, and the relevant skins are included in that.
Great. Thank you, Lucas. For cleaning the skin, are there any suggestions?
Yeah, look, one of the great things about the Nursing and Simulator has been the silicone skin. It is very resistant to stains, very resistant to markings. You can actually write on her with a ballpoint pen and wipe it off with even a mannequin wipe. So look, the actual cleaning regime has reduced significantly with the silicone skin. And what we recommend is really rubbing alcohol or isopropyl alcohol. Anything from 70% or higher works really nice on her.
Can you talk more about the different patient scenarios you could run with the simulator?
Yeah, look, a great question. There's really a large range of scenarios now that you can run with Nursing and Simulator. A lot of diversity when it comes to age, when it comes to ethnicities, when it comes to gender as well. So really, with Scenario Cloud, you're able to dial up what specialty you would like to actually train, maybe what area of the system that you'd like to train on, what simulator you have, what gender, what age, what ethnicity, and you can pull up scenarios that are relevant for your training needs.
Could you provide a little more information about the weight of the Nursing and Simulator?
Yeah, Nursing and Simulator is about 32 kilos. So the weight can vary slightly on some of the mannequins depending on which modules you have on her, but at 32 kilos or approximately 70 pounds.
Okay. Another question we have, can you control her eye movement?
Now you can control her blinking rate, her speed, even the movement. You can actually close one eyelid, keep the other one open. You've got variance there, but you can't actually move the eyeballs as such.
Another question we have on Nursing and Simulator, is the blood pressure automatic?
Now I mentioned earlier that we do have bilateral blood pressures. Now those can be taken both manually, so with a blood pressure cuff you can see on the geriatric mannequin there, or they can be taken with our simulated patient monitor. So those you can set up to automatic. You can set the duration every 2 minutes, 1 minute, 5 minutes, and it will take a blood pressure and display it on your screen for you.
Okay, thank you. The next question we have is regarding Laerdal Scenario Cloud.
Oh, wonderful.
Is it possible for me to try Scenario Cloud before I buy?
Yes, of course you can. We do have a 90-day trial that you can get a license for to really get in there, play with the full version of Scenario Cloud, and really get a taste of if this is something that you require and what you need.
Next question that's come in, how many devices can I use to run scenarios from Scenario Cloud?
Great question. As many as you like. There really is no limitation to the number of devices that you're running from that account.
How many users can access Scenario Cloud at my organization?
Look, that really depends on which license you purchase. There are 3 levels available with varying numbers of users that you have associated with those. And I would get in touch with your local Laerdal representative to really give you the options available. Of course, don't forget about the 90-day free trial as well, license that can be used to really access the whole system to get an idea of whether it meets your needs.
Thank you, Lucas. I see we have a few questions as well for Paul. So Paul, first question regarding SimCapture for Skills. What is the benefit of using this solution for my faculty?
That's a really good question. SimCapture for Skills is designed to make facilitation, assessment and evaluation simple for psychomotor skills. It can be used with any task trainer and it can be used on any device as it's a web application. This provides faculty more time to do what they do best, teaching their students.
Thank you, Paul. Next question we have here is also for SimCapture for Skills. How can faculty use the reports?
Faculty can use the reports for individual learning needs analysis to see how an individual is performing in psychomotor skills, but also a cohort analysis. This is important because we can help faculty to improve courses for students and make them safer for clinical placement or clinical practice.
Thank you, Paul. We have another question here about SimCapture for Skills in simulation. How can I use this solution in my simulation lab?
Peer-to-peer scenarios is ideal for formative practice in the lab. We can also use the self-record scenarios in the lab. For example, we could have a room set up as an exam station where a student could go and record themselves doing the psychomotor skill. This removes the one-on-one need for or relationship between the student and faculty, and it also helps reduce anxiety for the student.
Paul, you're absolutely correct. This is ideal for formative and summative assessments. Paul, the next question for you is, do you provide any pre-populated content with the interface?
Good question. We actually ask you what your assessment and evaluation criteria is, and we take that and we input that into SimCapture. This ensures that the content is aligned to your curriculum. We can also assist you to help build more scenarios for different courses.
How is my students' information kept confidential?
We keep customer data confidential in line with data protection and security requirements. We also have ISO 27001 certification. Our standard licensing term details our obligation in handling your data.
And we have time for one more question. Paul, can I use this with any skill trainer, including ones I already own?
Absolutely. You can use SimCapture for Skills with any task trainer. The ones that you have existing in your lab, any unused equipment. We can also be used for psychomotor skills that don't require a task trainer, such as washing hands, aseptic technique, or drawing out medication.
Great questions from the audience, and thank you to all who have submitted. There may have been some questions that have been posted in the Q&A box. Some of them have been answered during this event, and those that have not will be followed up on later. I hope you've learned more about these innovative nursing essentials to help improve the quality of training in your programs. Thank you all for attending, and take care.